Well, good afternoon and welcome to today's webinar, which is Workplace Suicide Prevention, Real Stories and Real Solutions. My name is Holly Foxworth. I'm a registered nurse, and I'm also the marketing director for marketing communications here at Axiom Medical. I first just want to thank all of you for coming today. That says so much about you, that you are willing to learn more yourself and take the time to know how to address those that may be in distress. So I appreciate all of you coming. This is one of the most important topics that we discuss every year. It's always kind of hard to discuss. Suicide is deeply personal. It's very emotional. Everybody's been impacted in various different ways, but especially in the workplace, it's often that quiet crisis that is always hush hush, and you don't see it coming until it's too late. So that's really what we want to change today. Is we're going to let you hear a powerful story from one of our very own clients. He's going to talk about the tragedy that they had experienced with losing one of their team members, and then how they've kind of transformed things after that. We're also going to give you a lot of tools, a lot of strategies that you're going to be able to implement immediately. That does include, I've asked Sarah Hathaway, who's actually on our panel. I'll talk about her in just a moment. She's an instructor there. I've asked her to give us a kind of a high-level overview of mental health first aid, because I think it's so necessary. Even as a nurse, I've always said that was one of the trainings that was the best and the most effective that I have ever attended. And so if you have not been through one of those trainings, I definitely would encourage you to go through one, put your employees through one. It really makes a difference. So we have a fantastic panel for us today. We have three different speakers that are joining us. As I mentioned, we have Rod. Rod Branch is the Chief HR Officer at Arcxis, and so he's going to be talking about their particular story, what had happened with them, where they lost a colleague, and then how that's really led to the change in the culture that they've experienced. We also have Sarah Hathaway. Sarah works at Axiom. She is the Director of Behavioral Health and Employee Absence Management. She's going to be going through how it is that you're going to be able to spot those warning signs early. She's going to go through the simplified version, as I'd mentioned, of mental health first aid. So what to say, what it is that you can do, how it is that you can really help somebody in distress. And then I've asked Dara Wheeler, our Chief Marketing Officer here at Axiom, to kick things off by sharing how our leadership team really prioritized mental health, how they decided to not just make claims, but really walk the walk. And so she's going to talk about what led to that decision, why we place such an urgency on that, and what that looks like in real life. So you will meet all three of them momentarily, but before you do so, let's talk about all the different things that are there on your screen. There's a lot of different benefits, and I want to make sure that you catch all of them. The first one is right there on the upper right-hand side of your screen. You should see like a green box, and that is for our next webinar. That is going to be winning strategies for reducing work comp expenses. That is next month. It'll be July 10th at 1:00 p.m. All that you need to do to get signed up for that will be to simply press that RSVP button. That will get you registered. It should send you a calendar invite. There's nothing additional that you would need to fill out there. Also, if you would like to come to ASSP Safety 25 in Orlando, Florida this year, that's going to be July 22nd through the 24th. We are going to be exhibiting, and we have free expo passes. So if you would like to come and you don't already have a ticket, we would love to have you join us. Drop your name right there in the chat box at the bottom, and we will make for sure that we can get you a free pass to come and join us. We're really excited. We have Dr. Tree that's going to be doing a flash session there on the expo floor, and so he's going to be going through the impacts of fatigue and how that impacts your workforce. So we're excited to have him join us this year on the floor. Additionally, we were talking about that box that's there at the bottom. That's really where all the action is going to happen today. So make sure that you know exactly where that is, because that's your way of interacting with us. That is also the first place that I like to go, where to select gifts to give away after these events for those that are really engaged. So if you have any questions, if you have a story, if something's happened in your workplace, you've had something happen in your family, anything that you want to share, I would encourage encourage you to do so. Just type it in there in the box, and we will make for sure that we get to you. And that goes for while we're giving our presentation. We like to weave those questions in instead of waiting until the end. So if you have any questions that come to mind, there's something that really resonates with you, speak up and let us know. We'd love to talk about that a little bit more. There are some additional resources that are there. Located there at the bottom, you should see a copy of today's slide deck that you can download yourself. There's also some blogs that are there, some additional resources. And then, of course, as always, these events are recorded, and we'll make that available to you within the next 24 hours. So we'll definitely make for sure that you have some additional access should you want to share this with your colleagues, some of your employees, et cetera. All right, well, let's go ahead and meet our panelists. At this point, Darren, we will start with you, followed by Sarah, and then we'll wrap up with Rod.
Thank you, Holly. My name is Dara Wheeler, and I'm Axiom's Chief Marketing Officer. I'm happy to be here today to talk about an important topic, and glad that we have Rod and Sarah joining us. So I'll kick it over to you.
Awesome. Sarah?
Hi, I'm Sarah Hathaway. I'm Axiom's Director of Behavioral Health and Employee Absence Management. I'm a licensed clinical social worker, and I've spent most of my career in workplace mental health and disability and workers' compensation systems. So happy to be here today.
And she's fantastic. She's fantastic. We really appreciate her. All right, Rod.
Hi, I'm Rod Branch. I'm the Chief Human Resources Officer for Arcxis. We're a builder services company here in Houston, but we are in 27 states across the country. Been here about 4 years now, and got some interesting and somewhat tragic stories to tell today. So I'm looking forward to doing that with you all.
Awesome. Well, I appreciate all three of you joining us today. It really makes a difference. And I know that our audience will really benefit from what you have to share. Just to give you an idea of what we're going to be going through today, we're going to cover how it is that you're going to be able to recognize some of those early warning signs of a mental health crisis. We're obviously going to talk about Arcxis' journey, talk about the tragedy that they experienced, and then how that's really changed their culture since then. We're going to be going through some easy ways that you can respond to support some of those coworkers that may be in distress. And then we're going to wrap up with how it is that you build that culture, how people can feel safe enough to be able to speak up individually. So I am going to go to Dara first. I asked Dara to join us and to talk about kind of what had occurred at Axiom and how we kind of got started, how we got our program started and why it mattered to us. So Dara, if you want to talk about why this is important to us, I would really appreciate it.
Yeah, thank you, Holly. It's been really interesting. I think Axiom's leadership and team have very much focused on building culture since I've been here. I've been here a long 19 years. But what triggered for us a lot of change from the top down and from the bottom up was the experience we had during the pandemic. We used to be a fully in-office company. We had a lot of in-person engagement, and we were focused on building that kind of internal culture. And then we, during COVID and the pandemic, went remote fully. And in doing that, we barely missed a beat, and we continued to service our clients and support them. And then we added the pandemic support components, which were very busy days because we had to service and help employees that were now dealing with other types of work-related situations besides injuries. We, as most of you know, have nurses on staff. We have a lot of employees that were very busy during those days, and we started to notice that our own teams were starting to struggle with mental health and burnout. And we made a very conscious decision as a team to start investing in our own employees and what kind of programs that we could then provide, not just our employees, but start supporting our clients' employees as well. So we brought people like Sarah in. Sarah not only is an amazing support for our clients, she's an amazing support for our own team members. and building that culture of proactive support. I think when Sarah first started, one of the first questions we were all asked is, what's your EAP? Who provides it? And what's the phone number? Nobody knew. So in the years of helping employees with various programs, and even though we kind of walked this walk, we needed to start building our own processes to make a real improvement, a real difference. And when we were talking to clients about total worker health and the whole person and care across this whole spectrum, we weren't doing that for our own employees. And so until we could say that we did that internally, it was a really difficult thing to sell externally. So not only did we make the change for our clients and products and services, but we also started to make that change internally. And I think it's been a process, but it has been a really positive one. And I know Sarah was a big part of that.
Absolutely. Before we go to you, Sarah, I'm going to put up just kind of a poll question here for you guys, just to ask you guys individually, and you can put your answer there in the chat. If you had a coworker that had came up to you and told you that they were thinking about ending their life, would you know what to do right then and there? So it's an easy yes or no answer. This is really more of just kind of gauging where you're at, and then we'll compare that whenever we get done today after we go through some of these steps. But let us know how you feel, whether you feel like that you would be prepared at this very moment to be able to help a coworker that had let you know that they were going to end their life with a simple yes or no, and then we'll compare those in the end. Sarah, talk to us about the realities of suicide there in the workplace.
Yeah. Unfortunately, suicide is one of the leading causes of death among all working age adults. And it continues to grow every year in the number of suicides, particularly in the US, but worldwide as well. And the reality is it's costing us loved ones, it's costing employees, coworkers, and it's costing companies a lot as well. Unfortunately, in the work world and just in general, we haven't done a wonderful job of addressing mental health proactively. We have services, they exist out there, and we hope that people will use them and access them and get what they need out of them when they need it. But unfortunately, that's just not the case. And companies and employees are suffering because of it. Companies are losing a great deal of productivity. There's a significant cost when employees aren't showing up to work, or aren't productive at work, or get injured at work because of poor mental health, or leave their jobs because of mental health. And in not addressing this, we not only see the impacts of the existing workforce, but we also see the loss of individuals who end up dying by suicide. Unfortunately, we work with some of the most high-risk industries for suicide: oil and gas extraction, construction, manufacturing, and these are industries that have a higher risk, but also ones where it's not typically the culture to talk about mental health. And so that's something that is incredibly important, is creating that shift in the mental health culture and the culture around wellness.
Absolutely. It's interesting that you'd mentioned that. Mark Taylor had just asked specifically, is the construction industry a leading workforce for workplace suicide? So I appreciate you definitely mentioning that. Are there any others that you want to highlight? Any other industries that you feel like that really are kind of on that cusp there?
Yeah, one, for example, healthcare, and our own internal nurses, right? We work in the healthcare industry, and that's another one where the risk of suicide is incredibly high. If you work in particular in a physically demanding or high stress type of industry, if you work in a male dominated industry, or anything where there is a high risk to safety, again, which is most of the companies that we work with and probably most of the people who are on this call, the risk of suicide is just much higher.
Mm-hmm. Absolutely. Brandon, I see your question, and we definitely are going to get to that. So I just want to let you know that I do see that, and we will get to that momentarily. Talk to us then, Sarah, about some of the signs and symptoms, what you may be able to recognize when someone would be in distress there.
Yeah. So there's been a lot of research around suicide and what causes someone to end their life. And the two primary factors, which it probably sounds a little simple when I say it, but the two primary factors that contribute to suicide are psychological pain and a sense of hopelessness. So if somebody is in a great deal of pain, but they know that it may be short-lived and they see a possible end or solution, a way to manage that reduces the risk of suicide. But if they're in a great deal of pain and they're hopeless and feeling like there's no way out, no way to manage it, that greatly contributes to the risk of suicide. And then the primary factor in someone actually moving forward is an acquired capability. So what that means is basically that we're not born with the innate ability to end our lives. We have to build some sort of tolerance for that type of death. We have to build a tolerance or lack of a fear around death, become more desensitized to things like violence, death, or suicide. And so with that, when you see these three things in combination, that's a pretty good indicator that suicide is a very likely outcome. Now in the workplace, and especially if you aren't on site with a lot of your colleagues, it can be much harder to identify those things. But some of the things that we do see in the workplace is employees maybe withdrawing, isolating themselves. Some other factors that can contribute to suicide are a lack of belonging. So feeling like I don't fit in. And also a perceived sense of being a burden. I am putting too much on other people. I'm a burden to other people and I don't want to do that. So people will withdraw in order to not be that burden or because they don't feel like they fit in. We're always looking for changes in particular. So changes in mood, changes in behavior. Oftentimes we talk about decreased performance when we talk about mental health issues, but unfortunately, actually performance is one of the last things to suffer for a lot of individuals, especially those in leadership roles and individuals who are high achieving. Performance can suffer, but it's generally not to the extent that it's going to be noticeable by others until things have gotten really bad and unmanageable. So it's something to pay attention to. And if you're noticing that significant change in somebody who otherwise performs very well, that's an indicator that things have really deteriorated significantly. Similarly, individuals not showing up to work or not being able to complete their job duties in the way that they have before. Again, one more noticeable way that you might see that.
Mm-hmm, mm-hmm. Sarah, there was a question that came in. Diane was asking, so it would definitely, so it would definitely send them to high risk in the medical field, become desensitized. Do you feel like that? How do you feel about that?
Yeah, absolutely. So individuals who are working in those high stress roles, roles where they do see a lot of death and dying, or where safety risks are the norm, it does create that desensitization to life-threatening situations or desensitization to death. And so that is part of what contributes to some of those industries that we talked about being so high risk.
Absolutely. And what would you recommend then for some of these leaders that are on the call then on how it is that they would recognize some of these signs? How would they be able to recognize them?
Have the conversations,
Yeah.
talk to your employees, check in with them, ask more beyond the, hey, how you doing? Make sure that you're taking that time and devoting it to people. And if you do see any sort of signs, ask more. I think oftentimes we worry, especially those of us in leadership roles, we worry about being too intrusive. And so we don't say or do anything. And that's what we really have to be mindful of, is really checking in and asking some of those hard questions. I know I've said at times to people when I've had a concern, especially about their mental health or that somebody might be suicidal, like, hey, I don't know if maybe I'm kind of going down the wrong track here, but I would regret if I didn't ask this right now. Are you doing okay? Or I've noticed this change. Are you thinking about suicide, or is there something more going on that we should talk about? I have never once had anybody get offended by that question. I think that's always the fear, right? Of you're getting too much in my business. But I always say I'd regret it if I didn't ask, and I was, and I had been right.
Absolutely. Yvette, thanks for sharing there as well. She'd mentioned that she'd worked at the Texas prison system for 21 years and had 3 people who she knew personally who had committed suicide. That's very hard, extremely hard. And actually that leads us right into hearing from Rod and kind of what occurred at their organization. So Rod, talk to us about what happened at Arcxis and what you guys had experienced.
Yeah, it's a shame that we had to have such a tragic event that sort of snapped us to what we needed to be doing. But in January of this year, about 7:30 in the morning, I got a call from one of our senior executives, and he said he'd got an email from a staff member saying that by the time that he read that she would be dead, she would be gone. He was panicked, and I said, look, hey, I've had a few of these in my career, not very many, fortunately, but usually when people telegraph that they're going to do it, that they don't really do it. They're just trying to reach out and get some help. Well, I was wrong. She did it. And we found out later that several others had gotten an email or a text during the night. So by the time I got to the office, it was already a bit of chaos going on. This was a person who was well known through the system. We're in 27 states, but everybody knew this person's name. They may not even known, what she looked like, but they knew her. And so, the CHRO mode kicked in, and I buried my personal emotions about it. And I went to work, and I reached out to our EAP. And this was, by the way, about 8:30 in the morning. And they said they could be there promptly at 2:30 in the afternoon. Well, a lot was going to be happening between 8:30 and 2:30. And the first thing I knew that needed to happen was I needed to go down to that department and talk to those coworkers that had lost their workmate. So I did my best. I mean, we didn't have a script for that. We weren't really prepared for that. I fortunately had done a lot of grief friend counseling, and I knew some of the things that were appropriate to say, but I wasn't prepared, for that. I reassured them it wasn't their fault, and that, the EAP would be there in the afternoon. By the way, no one in the office went to visit with the EAP, who had a conference room to himself. No one went. I sat down and I wrote a letter to all the employees as best I could to explain that, she was no longer with us, and that, our hearts went out to their family, and and all those things. But again, wasn't prepared, didn't have a template for that. And when you sit in this chair, this is the person people look to have all of the answers. And I had very few rehearsed answers for that. Ironically, I was supposed to speak that afternoon at an Axiom event in the Woodlands, Texas, and I had committed to speak, and I contacted my account executive and told her that, hey, I'm going to come, but I may not be my best self today, but I'm committed to being there. And in the course of speaking, the topic sort of came up, and I decided, well, I'm just going to go ahead and share, what I had experienced that day. And Sarah happened to be sitting about 6 feet from me, where I was sitting in the panel chair that I was in, and got to know her. And fortunately, my account executive sat me next to her at dinner that night, and she helped me process what I had experienced that day. And when you bury it, sometimes you bury it pretty deep, and it just needs to come out at some point. She not only helped me, but she helped a couple of other our staff members, and we weren't really contracted with Axiom to do that work, but they stepped up and helped me out at a time when I really needed it. But the bottom line is we just weren't prepared, and we found out that other employees had been telegraphed by this person who took her life that she wasn't doing well, and we had not equipped them. We could argue whether it was our responsibility to do that or not, but we could have had the opportunity and didn't equip them with what to say in that moment. And maybe it would have made a difference, and maybe it wouldn't have, but they didn't have those tools. They didn't know they were supposed to do anything or say anything. So, we had not prepared any outlet for anybody who was experiencing that with another employee. So we took all that information and go to the next slide. We said, wait, we've got to do something more affirmatively than we've been doing. And, we searched resources, and Sarah was very helpful in connecting me to some resources for some leadership education. So here's what you should know for your department if these things happen. Here's what you need to be reinforcing. Here's how you can open that door a little bit wider for your employees to raise their hand and say, I'm having a bit of a struggle. Mm-hmm. And then we contracted with Axiom to add behavioral health for the same phone number as they call for a physical injury, which is the contract we were under at the time. And so they didn't have to remember a new number, and it's all on their hard hat stickers and their laptop stickers. And, those of us in the office, we have a little poster next to our screen. So we always have that number handy. And it's an additional number that they can call, kind of like the 988 number, where they're going to get somebody on the phone immediately and get immediate support and help and directing them to some resources. So that was sort of the behavioral health integration part of our injury management system. Now we have a behavioral health feature as well. So we're really happy about that. We opened up the dialogue and made it okay at company meetings for people to raise their hand and say that either they didn't know how to handle certain situations, or maybe they were having a struggle, or they knew somebody was having a struggle, and we could then direct them to resources. But I think people wouldn't have raised their hand before this tragedy that we had. And then, we have this ongoing now commitment to creating focus groups and outlets and places where people can tell stories and seek help that we didn't have before. And I don't want anybody out there that's listening today, whether you use Axiom or not, to not have some plan and some way to open that line, that channel for people to communicate when a coworker is having a struggle or when they're having a struggle. I don't want you to have to go through what we did in order to get there. Mm-hmm. So I'll stop there. If anybody's got any questions about what we went through, or how we got focused on where we were focused and those kind of things.
Yeah. There was a question, and I'll kind of refer to you and Sarah here, but Mark was asking, why do you think that nobody wanted to speak with EAP whenever that had occurred? And he had mentioned in construction, the employees think that it may be seen as a sign of weakness to share some of the things that may be going on in their lives. And so they were asking, is it okay to verbalize some of these things? Why do you think that occurred in that way?
It's not the first time I've had that happen with an EAP. It's somebody you don't know. You have to physically go sit in front of them. People watch you go into that room. So that whole macho thing about the construction industry, which we're in, is certainly alive when that happens. whereas you could pick up the phone and call the Axiom number and be in your private office and, you know, have all the emotions that you want to have in that moment and not have to worry about it. Sarah, what could you add to that?
Yeah, I have been the on-site consultant for various EAPs at times, and unfortunately, that's the norm. And I will say probably across all industries. You know, when an EAP consultant comes out on site, I always think that it's important to build some rapport in order to get people to come talk. So I always recommend that companies set up a group discussion with the consultant who's coming out so that they can build a bit of familiarity. And sometimes that's an educational group so that the consultant is just kind of speaking to individuals, sharing some information. Other times it's more of a small group, interactive, where people can feel they're sharing in a more comfortable space with their colleagues who they already feel comfortable with. But yeah, if somebody's sitting in a room, I mean, I've been on that side of it too in situations. If somebody's sitting in a room that I've never met before, am I going to walk in there and introduce myself when I'm already struggling?
Right.
It's hard to ask for help, and it's especially hard to go to a stranger to ask for help.
And this was 6 hours after the news hit, you know, so
Wow.
it wasn't real time for these folks when they really needed it.
Sarah, you were talking about, you know, we were kind of talking about the processes and things like that. And there was someone that had shared earlier as a suicide survivor and a safety director who lost one person to their battle with suicide. How successful is it that you can do these, that you can ask these mental health questions during these calls? How successful can that be on asking, you know, doing the screening and then being able to get them to resources?
Yeah, so having, on our end, having a standardized screening has really opened up some opportunities for conversations with individuals where all other signs would have pointed to this person as fine. But being able to do a standardized screening allows us to get some additional information that someone wouldn't otherwise share. And it has opened the door to conversations about suicide with individuals who were contemplating suicide, had recently attempted suicide, and get them connected with resources. I will say there's always, when someone's feeling suicidal, there's always that fear of sharing what they're going through and the fear of what happens, what, you know, is there some big alarm that's going to go off the second that I say these words out loud? But the reality is just asking the questions and just asking someone if they're feeling suicidal reduces the risk of a suicide. And so if you're ever questioning, should I ask it or not? The answer is yes, ask it.
Thank you for
Sarah,
saying that.
I know that a couple of the experiences you've had actually leads into this question we just had from the audience. One of our audience members is a U.S. Navy veteran and in health and safety, and talking about how veterans are another high-risk area or with a background. And if you know your employee's background, you know they're a veteran, you know that there's a potential risk there. I know that a couple of the cases that you've dealt with, they were no longer in the military, but were ex-military and were dealing with some pretty significant mental health challenges.
Yes. And that is another culture where talking about mental health isn't necessarily normalized. And it's a very, it's a culture of toughness is what I generally call it, because you have to be very stoic, very controlled. And it's expected that you cope in very difficult times. And especially for those, whether it's active duty or those who have come out and have transitioned into a completely different culture, it can be especially difficult. And so, I agree with the comment in here of, knowing your population, knowing your employee's background is really important to understanding what those risk factors might be.
Sure. It looks like there's a lot of questions too that go towards, is it okay from an HR standpoint to ask these questions? Is there anything that would prevent them from an HR standpoint from asking directly, are you thinking of suicide?
Yeah, it's a great question. As employers, we have to be cautious about asking about mental health or medical conditions, things that could potentially create an issue regarding any perceived or real discrimination, or issues with restrictions or accommodations related to a mental health concern. So we do have to be mindful about how we ask the question. We aren't going to ask someone, are you diagnosed with depression? Are you taking psych meds? Things like that. Suicide is not a diagnosable condition. And so we can ask someone if they're contemplating suicide. It would be similar to asking someone, are you thinking about quitting? Are you safe to drive today? We can ask those types of questions. And truly, it's important to ask the questions.
Absolutely.
So any of the HR people that are on the phone or on the call today, we often have people in front of us who are distraught. Either, everybody's got that invisible backpack they're carrying around with all of their stuff in it, their family stuff, their financial stuff, their, all of the stresses of life that they walk around with. And sometimes when they're in front of a listening HR professional, they will want to spill more than maybe even we should know. And so we have to be very careful not to become the psychologist or psychiatrist for them, and recognize where that boundary is and refer them to some professional help outside. And we're happy to help them with that through their benefits program. But we've got to know where that line is that we should not cross and become that pseudo professional for them.
Excellent points. Sarah, there were some other questions here that I talked about recognizing some of those signs, and I know that you're going to get into the mental health first aid next, but there was one that had mentioned that they had lost their sister and daughter to suicide about 3 years ago, and they never saw anything that really stood out. So they still really don't know the reason. And then in addition to that, there was a question of, if somebody says it jokingly, could that be a sign that that's what they're thinking of?
Yeah. Our research shows us that when someone ends their life, there are almost always warning signs. But I say that with a caveat that doesn't mean that they're warning signs that are easily recognizable. It doesn't mean that there are warning signs that were presented in front of you to be recognized. And unfortunately, suicide is almost never about just one thing. It's usually a complex issue, various factors that are impacting somebody to the extent that they feel entirely hopeless. So when we try to answer those why questions, it's one of those things that tends to create more questions. Even if we do find things out, we find more questions than answers.
Okay.
Regarding the question about someone making a joking comment, I think that's a really important time to just pause and say, hey, I know that you might have said that in a joking way, but I got to just check, is there any bit of truth in that? What's causing you to think about that? Because it may partially be joking. Laughter also is a way of coping. So we have to be mindful that even if somebody's laughing, saying something as a joke, that it still could be very serious.
Very much so. Sarah, that takes us right into, there's a lot of questions. I'm sorry, was somebody else going to mention something? Dara, were you going to say something? No. I mean, I'm just
I was on mute.
Okay, all right. Well, that takes us right into talking about mental health first aid, and I think that this will answer a lot of the questions that are here in the chat. Sarah, take us through what that framework looks like, and what those steps would be.
Yeah. So this is the ALGE model from mental health first aid, and so this is a very broad brushstroke of what mental health first aid offers. But the ALGE framework is a way to really guide interactions with somebody when you have a concern about someone's mental health. This can be used for suicide risk, but also for any other type of mental health concerns, including substance use, even just general stress. So The algae model is designed to be nonlinear, which means that you can use any part of this sequence at any time, in any order, in whatever way it works for that situation. But the important things to consider, first, the A is approach and assess and assist. I personally think the approach in most cases is the hardest part. Because we do this, should I, shouldn't I, what will I say, how will I start? But starting the conversation is the most important thing that you can do. The L is listen non-judgmentally. So we want to make sure that regardless of the situation, regardless of how frustrating things might be with a particular employee or this, you know, hey, now this is putting us down in staffing, or their performance has been really poor, or they're, you know, angry and difficult to work with, we really have to take that non-judgmental stance because this person's safety and well-being is the most important thing right now. And if we come with judgment, we come with bias, all we're going to do is shut down that conversation. The G is give reassurance and information. And what that looks like is providing that support, that reassurance that you're going to be there and you're going to support them, and that it is possible to get through the situation that they're in right now, and information about how they can do that, that there are resources available to support them. Now, the two E's go hand in hand. Encourage professional help and encourage self-help and support. So not everyone who's dealing with a mental health concern requires professional help. Now, in a suicide crisis, absolutely professional help is going to be necessary. But in a general mental health challenge, if we're having a rough day, we're going through a stressful time, sometimes just that self-help and some good strategies is all we really need. But those two things really go hand in hand in supporting mental health. So again, this is really, really simplified version. The mental health first aid training and certification really goes in depth into individual situations like suicide risk, substance use, psychosis, anxiety, depression, all of those types of situations, and how you can respond effectively using this model for each of those. But these pieces will help to guide you in those interactions.
Excellent. Do you have any ways, any suggestions that you would recommend on how it is that you would approach somebody and what specifically to say?
Yeah. You know, it really does depend on the situation. It depends on the relationship, right? How comfortable are you with this person? How open is this person with you? I always figure start slow, take your time. And I start with what I'm noticing or what my concerns are. You know, hey, I've noticed that you've really been kind of taking a step back from things at work, and you seem like you're not really fully involved when we're on a meeting, or seems like maybe you got some other things on your mind. Is everything going okay? Can we talk about it? I ask permission. I don't ask if they want to, because I find oftentimes if you say, would you like this? Or would you like somebody to touch base with you? Would you like to talk about it? People go, oh, no, I'm okay. But if you say, can I give you a call? Can we talk about this? Most people will accept. So I think that's really important.
Yeah. There's some other questions on here. Daniel was asking, are there any triggers that would cause the situation, worse in the conversation?
I think it goes back to that listening non-judgmentally, that judgment, that bias. Those are things that are going to shut down a conversation quickly. But then the alternative, minimizing or dismissing. If we minimize and think that this isn't such a big deal, you know, tell people you'll be fine, you know, get back to work, suck it up, whatever, you know, those types of comments of this isn't such a big deal, get over it. Those are the types of things that are going to worsen the situation. But if you're coming with care and compassion and a true desire to understand and assist, it's hard to go wrong.
Yeah. Mabel had asked, she said, I had an employee who said that she felt like ending her life, and she was asking what should she have done in that situation?
The first thing, don't leave the employee alone. Always assuring safety first. We don't know until we've asked more questions how imminent that risk is. So make sure that that employee is not left alone. And if they are alone and you're not able to be there with them, find out who can be, whether that's a manager, a colleague, even do you have a friend or a family member who can come sit with you while we work through this? Really try to make sure that that person has some support with them. And then I, again, start with just asking more questions of what's going on? What's causing you to feel this way? Have you been feeling this way for a while? Or is this something that just came up? I also ask questions about, do you have a plan? Have you, have you come up with some sort of a plan for this? Because it's very possible that they already have one. And then from there, I think it's important to work together to figure out what that next step is. So for Rod, it's usually called, in his team, it's calling Axiom and having us talk to that employee. If that's not a relationship that you have with Axiom, then it might be through your employee assistance program of, hey, we're going to call the EAP together, get them on the line. And I don't have to listen to the conversation, but we're going to get them on the line just to make sure that you're getting that support. Or we're going to call the National Suicide Prevention Lifeline together, making sure that there's that connection to the next step. I will tell you from many years of experience, giving someone a phone number to call is not going to get them to call it, unfortunately. I wish it were that easy, but it's not. So we want to make sure that we help that person get on the line, take that step, so that they're in the hands of someone qualified to assist further.
There was one more interesting question that came through. It kind of looks at it from a different perspective, but it said, let's say that someone comes to you for the first time and you want to help, and so that you do so, but then they keep coming to you as a resource, but that's something that's difficult for you to handle. What's a gentle way to redirect them to someone else without making them feel like that you don't care?
I think that's a really great question. Once someone makes connection with somebody that they see as a support, especially if they don't feel comfortable talking with others, it's natural that they're going to want to come back to you, right? And so I think it's important to say, hey, I really care about you and I want to make sure you have all the support that you need. I just realized that this is not something that I'm qualified to help you with as well as you need. And so I want to make sure that you have the support that you need in place. So can we get you connected with that? Or do you have someone, do you have a therapist that you're talking to? Do you have somebody that you can go to for these types of things? And if not, can I help you with that?
Okay.
Yeah, I also think it depends on your role with the person too. If this is a workplace situation, if you're their direct supervisor or an HR rep that they are now becoming really comfortable going to, I think it really depends on that kind of relationship. If somebody is continuing to struggle, like Sarah said, somebody that's a professional therapist knows how to establish boundaries and to deal with walking away at the end of the night and not taking that burden home with them. But if you are somebody that is a manager or a supervisor, you're not a professional therapist. You are not typically trained in that type of experience and boundary setting. And so finding for yourself a way to be super supportive of your employee without risking your own mental health and boundaries is really important. And often you can get support through some of the same processes that you would be recommending an employee go through, because it can become really hard if you are coaching and supporting a lot of employees through difficult situations to maintain your own health through that. So it is something, I think it's a great question. I do think that it is important to think about and make sure that you have established processes and ways of dealing with various situations.
Thank you, Dara. One more question, and then we're going to talk about how it is that you can kind of change the culture and what you need to say to be able to communicate directly with some of your executives, et cetera. But there was one more question that I thought was important. And it was, how can we truly tell the difference between someone experiencing suicidal thoughts and someone simply battling anxiety or experiencing burnout?
The reality is, in a lot of situations, you may not be able to tell the difference. A lot of the signs and symptoms are going to look very similar. And if someone is not open to you about what's truly going on, and especially if you are in a supervisory or HR role, you can't ask those specific questions. You may not know. And that's where I think really leaning on getting people connected and making people aware of the appropriate resources and professional support resources that you have through your company, or that are available to any employee through, or any individual through things like the National Suicide Prevention Lifeline, that type of thing, is really important, so that you're not taking on the role of becoming the clinician.
Sure. Yeah. Dara, talk to us about creating a culture of care. How is it that you make that change? And then let's bridge over and kind of talk about how we can speak to executives, because there's lots of questions about, what do I say? What do I say so that people understand that, this is an issue that we need to address here in the workplace?
Yeah, and I think I've even seen a few questions about risk on either inaction or action. So I do think, although I can't give you direct legal or risk management recommendations, what I would say is it is a top-down approach. And when you think about making real change, it's not that you can't make change from the bottom up, but if you do not get support going at the top level, it is going to be very difficult to fully change a culture. And I know Rod has expressed this repeatedly at Arcxis. It is always a top-down conversation. And from the CEO and the board of directors down, everybody really cares about supporting this culture and this shift, safety, psychological safety, and building that resilient culture is really important to the whole organization. And they walk the walk. And so it is not, again, that you can't make changes, but that it's going to be to make real organizational changes, you do need to start at the top. Normalizing the discussion, keeping those conversations going. I talked at the start about how Axiom recognized a need with our own employees. We actually thought that employees were burnt out because of their workload, and we were wrong. And so we started with asking employees what their own experience was. And the burnout and the stress that was happening, actually, I'm sure work contributed, but it was coming from other sources. It was coming from family. It was coming from other challenging situations. And so if we had come in with a plan to only address the work that they were experiencing, we would have missed the mark. And I think a lot of organizations come in with really great ideas on how do we make change? Oh, let's immediately do this. Look, we've talked about mental health first aid. We also did that. And I think it is a big part of why the organization shifted. Mm-hmm. However, if we hadn't started with asking our employees what they were dealing with today, we wouldn't have known how to address what they were dealing with today with the right resources at the right time. I do think that resource piece is important. Resource access and what Sarah and her team do is often very creative, because based on situations, all resources aren't equal. And so when you think about access and how we get employees support, again, if you are talking and having a really open dialogue, what is a great solution for one may not always be the best solution for another. And this is across the board with the way Axiom manages all of our cases. We are very specific to the individual, their medical history, their experience, what they are dealing with in that situation. And by providing those correct resources for that individual, you are then handing them into a situation that will actually improve what they're dealing with. And building that internal culture so that everybody's speaking that same language through things like mental health first aid is really interesting and important. And at Axiom, it does another example of one thing that we experienced because employees were remote. One of the challenges was building those moments into the workday for interaction outside of tasks and meetings. And we set up a meeting that we call Wellness Wednesday as a reminder for people to check in with each other. And the first day we hosted a Wellness Wednesday, I think we had over 100 employees jump on to the call, and that was totally unexpected. So Sarah continues to lead those. Sometimes we have 5 people that can join. Sometimes we have 40 people that can join. But it's a really nice way to take a moment and check in. Sometimes it's heavier stuff that's going on. Sometimes it's really light stuff like cooking ideas or fun vacation ideas. But checking in with our employees outside of, hey, did you get the task done today, has become really important to the way we've built that and live that culture for the organization.
Absolutely. Building a culture is one thing, but sometimes getting that executive buy-in can be another. We had listed here some of the common objections that we have seen. Sarah, I know that top one right there, the part about we already have an EAP for that, that one that one strikes a nerve with you. Specifically, is there any additional ones that anybody on the panel would want to mention at this point that would further give them some information on how to approach or how to say something that an executive would understand? They'd be able to see it through the same lens.
I'll say one thing and then let Sarah and Rod finish up. Sarah and I have been on multiple calls with companies that are in the space, like we've talked about, construction, very heavy industry with high levels of kind of that masculine, very much like we don't talk about it. And they have often, the objection has been, these employees won't talk about it. You're wrong. These employees will talk about it. They need access. And what I see time and time again is when you open that conversation up, they are desperate to have the conversation. And so don't assume that because it's a kind of a good old boy mentality or a masculine energy in that room, that these employees don't want to talk about it.
Absolutely. Anything, Rod and Sarah, that you'd want to add to that?
Susan Habib has had a comment in here about, is it possible that the company would take it as a negative and potentially fire the person? That's an education problem that I think it's HR's responsibility, not solely, but I think they certainly should take the lead on educating their leadership when they get these comments or circumstances or issues in front of them, to understand that this is a very serious situation, and it's irresponsible to do anything but do something towards helping the person. Is it possible? I'm sure there are some isolated places where people just don't have the right thing to do in front of them and do the wrong thing.
Absolutely. Sarah, I'd add some suicide resources on here. Do you want to quickly go over that? And then we're going to do a final poll and wrap up here. I think we've got about 2 minutes.
Yeah, so thank you. As far as the resources go, I've touched on the National Suicide Prevention Lifeline. You can call or text 988 to access support for yourself or someone else. I'll also add with that, similar to your EAP, if you ever have a concern about someone, and I saw a question about what if they don't accept the help, what do you do? You can, one, let them know I'm here if you change your mind or if you decide you need something, but you can also contact these resources yourself. You can get confidential support anytime and some guidance on how to navigate a situation when you don't know what to do. You don't have to do it yourself.
Absolutely. Well, one last question I wanted to revisit again. So now that we've gone through all of this, let us know in the chat if a coworker had told you that they were thinking about ending their life, would you know what to do at this point? So we'll let you into that. I appreciate all of you attending today. This was fantastic. You had some excellent questions. I'll definitely have lots of love notes that I'll be sending out as we wrap this up today, and we'll be sending some gifts to many of you. These were fantastic questions. Again, just a reminder, if you haven't already done so, make sure that you press that RSVP button there at the top to join us for the event this next month, and we look forward to seeing you then. Thank you.
Thank you, Holly.